Primary Care, Henry Ford Jackson Health, Kelly Truchan. Good morning.
Good morning.
How are you doing today?
I'm well. Thank you so much for having me.
Yeah, of course. It's great to have you here. Tell me a little bit about your history in healthcare.
So I grew up in the area, which is extra exciting to be here because I've watched JTV for my whole life. So again, thanks for having me on.
Pleasure to have you.
But went right into nursing school after graduating high school and achieved my RN degree. After that, I started working at Henry Ford Jackson in the emergency department, where I was there for a little over 5 years. During that time, I started working towards my bachelor's degree in nursing, and then my master's degree as well. So just as I was finishing up my master's degree, I was offered a great position at Adrian College to be the director of health services. So I managed all healthcare operations throughout campus.
Wow.
I stayed there for 3 academic years, and during that time, you know, I have this drive and motivation to keep going, so I decided to start pursuing my doctorate degree.
Awesome.
And then about a year and a half ago, I was recruited to rejoin Henry Ford to be a family nurse practitioner in our primary care office. Love it there, and have since completed my doctorate degree from Spring Arbor University.
Congratulations.
Thank you.
Jackson is lucky to have you back home.
Thank you. I appreciate that. It's good to be back home. I love the community. I love taking care of the people here.
Now today we're going to talk a little bit about, we'll start talking about annual checkups, and some people skip those. Why are those important to never skip, even if you think you feel fine?
Right. Well, that's the thing, right? Some of these health conditions can progress silently. So high blood pressure, high blood glucose, even some cancers can progress undetected. So very important to get into your family practice and visit with your primary care team to discuss risk factors that you might have, go over medication management, lab results and such, and formulate a plan together with your primary care team to mitigate those risks.
What are some common issues that maybe can be solved or at least talked about at some of those annual visits?
Yeah, so some of the health conditions, we talk about, like I said, the risk of, family risk of certain diseases and health conditions. We talk about managing blood pressures, blood sugars, risk for certain cancers and other diseases as well. And again, just making sure we formulate a good plan going forward so that we're well aware of our knowledge and how we can prevent future disease.
I'm going to ask you to give me some maybe healthy habits or tips, especially as we approach, Jeremy and I were just talking about holiday season. We can maybe overextend ourselves a little bit. Do you have any tips that you can share with us as we approach the holidays? Yeah,
so I always encourage balance. Right? So getting regular activity in, eating a healthy diet, making sure you're visiting with your primary care team. Those simple habits there, they can really stick, and those make a big difference in the long run. And like it says, own your wellness. So take charge of your health, and so that you can have more tomorrows with the ones you love.
And following some of these tips, it can help to maybe not eliminate stress. It is a stressful time of year, but it can probably help reduce some stress.
Yes, absolutely. And during this time, we do see a lot of stress-related conditions, higher blood pressure, weight gain, things like that. So during this time, it's especially important to do those simple steps, going for a walk, even if it's a 20-minute walk. Journaling or meditation or prayer, something, mental health is very important. So those things can help build a good mental health and keep us healthy during this time so that it's not so chaotic and you can enjoy the fun season. A
lot of people will be traveling, and some people may get out of their diet. What are good ways, what's some good advice to help people kind of stick to those habits even while they're traveling for the holidays, or again, maybe attending some holiday parties and things like that?
Right. I always say plan ahead, plan as much as you can. So if that means packing some additional healthy snacks, that is a fantastic idea, as well as planning your meals forward and then working together with those that you're traveling with your family. So it's a team effort.
Yeah, families can help support each other.
Absolutely. Yes, it's a team effort. Maybe even you can plan your well visits together.
Yeah.
and formulate the plan together of how you're going to stay active and eat healthy, cook together perhaps. And that way it's not an individual burden, it's
Sure.
a team effort.
Kelly, do you see certain health conditions or certain concerns spike around this time of year in particular?
Yeah, in particular, we mentioned the stress-related conditions,
Sure.
certainly, and that stress can roll into a lot of mental health troubles as well. So really important to continue working on those healthy habits and just starting one at a time even. It doesn't have to be that you start multiple things at once, just
Yeah.
one thing at a time, journaling perhaps, or prayer, and working on those can really build consistent habits that give us good longevity.
Kelly, if someone hasn't scheduled their annual checkup, and you know who you are because you're thinking about it, what would you say to them right now to encourage them to make that appointment?
I would say your health is your greatest gift. So take charge of your health. Call, make that appointment, don't wait.
Yeah, don't wait. And I feel like a lot of, at least for me, I feel like between the age of 20 and 30, you get out of high school, you're in college, you feel healthy, and before you know it, a decade can go by in some cases.
Exactly. So that's why it's important to get into the doctor, and then you even have a little heads up of what's coming
Sure.
forward. So certain ages we start screening for certain conditions, and it's just good to know where you fall in that, or if maybe you need the screening sooner based on family history.
Yeah.
So definitely important to meet with the primary care team.
Kelly, we so appreciate you joining us here on Wellness Wednesday, and a conversation really that everyone needs to listen to as we try to make our community healthier. So Kelly, thank you so much for being with us on Wellness Wednesday.
Thank you so much for having me.
More of the show right after this. Stay with us.